So one of the things I found useful when I'm planning lessons and when I'm teaching topics is this idea of cognitive frameworks. And this comes from the pioneering work of David Ausubel, the American psychologist and psychiatrist. Published a lot of his work in 1968. And this is the idea that we don't have knowledge in isolation. All knowledge is interlinked. So, for example, we might be talking to a student who knows something about smoking. Now, when we want to start teaching someone, in this case about the dangers of smoking or anything to do with smoking, we need to find out what they know about it first already. Ausubel stressed this. The most important factor in education is what the learner already knows. So we need to talk to them first and see what they already know. So they might know that there's such a thing as smoking, and they might know that smoking is harmful to health. So this dot here represents knowledge of smoking. This dot here represents that it's bad for your health. It's a bad thing to do. Smoking's bad. Has health consequences. But can you see that the bad health consequences are related to the smoking? So knowledge that smoking exists, knowledge that smoking is harmful for health, two pieces of knowledge, but they're linked. They're linked like that. So the smoking is bad for health. The two concepts are linked. And someone might also know, if we talk to them, that the more they smoke, the worse it is. So that's another piece of knowledge. That dot there represents the individual piece of knowledge that repeated use makes health effects worse. So we see that the smoking and the repeated use are interlinked, and that the more someone smokes, the worse it is. So that's interlinked with that. And indeed, the whole thing's interlinked in this case, because smoking's bad. The more we smoke, the worse it is. And then if we carry on questioning someone, they might say, well, yeah, this does lead to specific health problems. This leads to particular diseases. They might not be sure what diseases it is, but they will know it leads to particular diseases. So smoking can lead to particular diseases. And in fact, the more we smoke, the greater the risk of those diseases. So we could maybe get that far. People might know that to begin with. So can you see what they've already got here is a cognitive framework? They've already got a structure in their head of individual pieces of knowledge represented by the dots. So they have the individual pieces of knowledge, but these pieces of knowledge are interrelated. So Ausubel stressed the importance of knowing what the learner already knows. So this is kind of what the learner already knows here. That's their existing cognitive framework about smoking. Now that we know that, we can then start to extend it. So we could tell them that there's such a thing as carcinogens. Carcinogens, chemicals that cause cancer. And when someone smokes, and the more they smoke, the more of these carcinogens they're exposed to. So we've now got a link between increased amounts of smoking and increased exposure to carcinogens. So we give them the information, we tell them about the carcinogens, but then we relate that to things they already know. And this means that their learning experience is becoming meaningful. This is meaningful learning. And the converse of meaningful learning is rote learning. We could get them to memorize things, but that wouldn't make much sense. They need to interlink the concepts. And then we could go on and say, well, the carcinogens, well, they can cause cancer. So we can say, well, there's such a disease as cancer. That's a piece of knowledge. There's such a disease as cancer. And carcinogens exist. But the more we smoke, the more likelihood that the carcinogens will cause this disease called cancer. So that's the disease of cancer there. Linked to the carcinogens. Can you see these are all linked together? They're not isolated pieces of knowledge. And then we could go on and say, well, look, there's such a thing as cancer of the esophagus. There's such a thing as cancer of the lung. Such a thing as cancer of the larynx. The mouth and pharynx can become malignant. There can be tumours in the bladder. There can be tumours in the pancreas, kidneys, liver, bowel, cervix, types of leukemia. All of these cancers, we can teach the individual learner that these exist, but that these are related to the carcinogens. So the carcinogens are going to make all these types of cancers more likely. So we haven't just said, right, I want you to memorise a list of cancers. Memorise this list. No, we're not saying that. We're making sense of it in the context of other pieces of knowledge. So each of these dots is an individual piece of knowledge, but they're all interrelated. So we can say, well, look, the more carcinogens you're exposed to, the more the respiratory membranes are going to be exposed to the cancer. Or the more carcinogens you're exposed to, then the more carcinogens will be absorbed in the blood. They will circulate around to organs like the pancreas, the kidney, and the liver, and potentially cause cancer in those organs. So we can explain the interrelationship between these things. We can say, look, the cancer can affect the bladder. So we know cancer can affect the bladder. But that's because the carcinogens are absorbed into the blood. Some of these carcinogens are filtered out by the kidneys in the urine, and the urine is stored in the bladder. So that gives us a link between the cancers and the carcinogens and the cancer. And of course the cancer as well. So we end up with many different interlinking concepts. So each dot is a piece of knowledge. Each line is information that links these. Or we could talk about ischemic heart disease. That smoking causes ischemic heart disease. And again, we could say why. It reduces the levels of the healthy high density lipoproteins and other effects. And then we could go on and talk about smoking cessation, and we could build up this cognitive map. So after one teaching session, we might get to there, for example. That might be the next sort of level of knowledge. And then when we come to the next teaching session, we could say, well, what's your role in this? Well, there's such a thing as smoking cessation. There's various drugs that can be used to stop smoking. The psychological and the pharmacological can assist each other, so they can be interlinked. And of course, these are all interlinked with the smoking, with the preventing the cancer, with you get many, many cognitive linkages. We want to prevent the heart disease. So we get understanding. Each of these red lines represents understanding. So ascertain what the learner already knows, then teach them accordingly, giving them new concepts, interlinking these concepts, relate the old, what is already known, to the new, interlink the concepts. This is called active assimilation. They can assimilate these new concepts. Concept maps, how items of knowledge are interrelated. One more thing Alcibel did say, he said you can give an overall picture, so you can kind of give an overall sketch of something. The idea that smoking's not a good idea. Then put individual pieces of knowledge in here to fill in the details. So we can put individual pieces of knowledge in here and fill them into the sort of the detail of the overall picture, and of course these will be interrelated. So we can build up progressively, or we can give an overall picture. Smoking's bad. Why is smoking bad? And then build up that idea. And then what do you do about it? So we can give like an overarching idea, an overview, and fill in the details later. But either way, it makes sense because we help the learner to make these cognitive links between the information so they understand the information so it's meaningful. Just one example here. Can you memorise those letters for me, please? Right, got that? Right, can you memorise those ones for me, please? Got that? Now, if I asked you to reproduce what was on that piece of paper now, I think you'd be struggling because it has no meaning. It is not meaningful learning. It would be rote learning. Yes, you could memorise those, but that, because you already know what these words mean, you know what this is means, you know what this means, you know what all the words mean, so it makes sense. So it's easy for you to assimilate this piece of knowledge that I went out for a walk with my dog. But that's based on your previous learning, based on your understanding of the words. So we're making linkages based on what you already know. So important to find out what the learner already knows, then to make links to individual pieces of knowledge. That means that they understand these pieces of knowledge in a meaningful way and how knowledge is interrelated. The challenge is, can you do this? Can you learn what the student already knows? Can you give them new information and make it meaningful to them as an individual? That is the challenge of the teacher.